Dr. Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'm going to talk about gout. Now, gout is one of those conditions that a lot of people say they have whenever they have a significant ache or pain or one of their joints hurt. In actuality, gout is actually a very specific condition which involves inflammation of a joint in which that joint becomes warm, red, hot, and swollen and is severely painful. Now, gout can affect a number of different joints, particularly the knees, the elbows, but it most commonly is found in the big toe joint. It's also found in the ankle as well. When you have gout, what is essentially happening is that when you eat certain foods, specifically such as certain proteins, the chemicals that are broken down as the foods are digested become numerous different types of chemicals during that breakdown process. And one of the results of that breakdown is a product called uric acid. Now, uric acid is basically a crystal, and the crystal circulates throughout the bloodstream until eventually it's removed by the kidneys through the urine. Well, people who have gout unfortunately have too much uric acid circulating throughout the bloodstream. The majority of people who develop gout just simply have too much of this going through the bloodstream because the kidneys aren't getting rid of the uric acid quickly enough. But there's about 10% of people who have gout that actually create too much uric acid that's floating around through the bloodstream. When this uric acid as a crystal is dissolved in the bloodstream and then suddenly there's a high concentration of it because it's not getting removed by the body, that crystal won't stay dissolved for long. Imagine pouring sugar into a glass of water and stirring it, and it stays dissolved. But if you keep pouring more and more sugar in, eventually that sugar has to return back to crystal because it can't stay dissolved inside the water. Well, the same thing happens with the uric acid. The uric acid crystallizes again, and it gets deposited in areas generally where joint temperature is a little bit less, and oftentimes that's going to be in the big toe joint itself. The uric acid itself is almost like little shards of glass, which create significant amount of irritation to the joint tissue, and subsequently the joints are going to significantly swell and become very warm and inflamed and quite painful. Now, gout in and of itself will resolve after a short period of time, sometimes as soon as 4 days, possibly longer, a couple weeks even. But during that period of time it's going to be quite painful, so it is a very good idea to actually get gout treated. Now, when you have big toe joint inflammation or any other joint, and it's red, warm, hot, and swollen, there is also a concern for there being a joint infection and not necessarily gout. So if you do develop a joint that is warm, red, hot, swollen, it's necessary that you get that evaluated to make sure that it's not gout, not a joint infection versus gout or some other process. Now, treatment for gout is essentially very easy. There are certain medications that can be taken which are potent anti-inflammatory medications which can reduce the inflammation associated with gout. Unfortunately, some of the better medications that are used to treat gout can cause some significant gastrointestinal problems with their use, but they are fairly effective at reducing the uric acid based inflammation. Now, if you do develop gout, and you develop gout several times a year, you might need to have medication be taken that will help prevent the gout from reoccurring. Some people do chronically get gout numerous times throughout the year because the uric acid level continuously runs high within their bloodstream, and that needs to be treated. Most of the time this condition is treated by primary care physicians or internists, but rheumatologists also get involved at a significant amount of times, especially if there's sort of chronic reoccurrence that's not being controlled. So if you do develop a red, warm, hot, swollen joint, in particular if it's in your foot and it's your ankle or your big toe joint, it's very necessary to get that evaluated to make sure that it's either gout or some other type of inflammation that might be more serious. Well, I hope you enjoyed this video. Please look for more videos on all things foot and ankle on this site as well as others, or you may visit my website at www.inpodiatrygroup.com. Thank you.